Now, if you listen to somebody from Canada, it's not the iliopsoas. It's the iliopsoas. I used to use a videotape. They probably don't use them anymore because they're tapes. I mentioned something to Dave, and he said, we don't even have anything to show those anymore. I think it's right there, actually.
Yeah.
Yeah, they're in the library. There are some interesting videotapes that I bought 20 years ago. One of the more interesting ones is this old professor doing a surface anatomy on his two nude models. Because you can really see the surface anatomy on those people because they're not obese. And they're not wearing any clothes either. I used to challenge the students to tell me why it was done over a period of weeks. How you could tell. Actually, one guy picked it up. It had to do with growth of surface hair. Okay. The iliopsoas is two muscles. I think it's useful to retain it as two muscles rather than what is called the iliopsoas. Now, let's do the iliacus first. The iliacus begins in the anterior iliac fossa. What's a fossa? A depression, a big hole. Okay? Big filled hole. And it goes distally over the bursa covering the hip joint to the lesser trochanter. Now this back here was the greater trochanter. This one down here is the lesser trochanter. Then you have the psoas major arising from the body and transverse process and disc of T12 through L5. So, how do you know you've got a thoracic vertebra?
It's kyphotic.
Huh?
It's kyphotic.
The democrats and the passive.
Oh, I like her answer better. Because a vertebra can't be kyphotic, can it? It takes a whole bunch of them. It's got an attachment for ribs, and it's got a larger transverse process, although they get smaller as you go down. So it's coming from here and here, down and crossing the hip joint down to the lesser trochanter. What will these muscles do as a group?
Hip flexion.
Lateral rotation.
Hip flexion, yeah, some lateral rotation, but more lateral bending, actually. Lateral rotation would be this, but lateral bending is this. But they're primarily hip flexors. Somebody said that you've been starting talking about manual muscle testing. I'm going to ask you another of my dumb questions. What is the value of learning manual muscle testing?
How are you supposed to have a place to start from if you don't know what somebody can do?
That's true. Now, what is the real value of a PTA learning manual muscle testing?
Isolate and strengthen specific muscles.
Isolating specific muscles. Tell me just a little more about strengthening. What are the two major types of grades of manual muscle testing? What's the only objective grade in manual muscle testing? By the way, are you learning Daniels and Worthingham or Kendall? Or does that make any sense to you? Kendall. You're using Kendall's book? Okay. She's a little wishy-washy. By the way, her videotapes are over there too. If you want to see Florence Kendall in action. 4 of the 5 are over there somewhere. What is the objective grade?
0.
No, 0 is not objective. Fair. Fair. Because in fair, you don't apply any pressure. Can the person move against gravity? Gravity is constant as long as you stay on Earth. What is the value of learning manual muscle testing? Okay, I'll tell you. It tells you the position in which you do therapeutic exercise. If I've got a fair muscle, I'm going to have them work against gravity. And you're right, you learn to eliminate muscles. Okay. Now, iliopsoas. It does what? Everybody do what the iliopsoas does. Brings the femur up. Or if I'm standing, leaning back, brings the pelvis forward. Okay. If I'm here and I'm leaning back like this, it would bring my pelvis forward. We talked yesterday, if I got a weak gluteus maximus, I'm going to tend to walk like this. What muscle group am I using? The hip flexors, probably the iliopsoas. Yeah. 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 Now, why do I care? Am I going to spend a lot of my career strengthening the iliopsoas? Oh, I might. Probably on my list of muscles, it's going to be down near the bottom. Students used to sit in this room 4 to 6 hours a day because we did a lot more in class than you folks do. Actually, we ignored class times and the little syllabus. You signed up for those. It was a way to give you credit. Okay, but we didn't have online things like pathology. I don't even understand online things very much. What was their danger? If I'm in a wheelchair, what is my danger?
Contraction.
Of the iliopsoas. I'm going to spend more time in my career not helping patients strengthen the iliopsoas, but helping patients
Stretch.
the iliopsoas. And one of the things I often do before stretching, okay, a patient's got back pain. I've got a tight iliopsoas. How am I going to walk? But am I going to walk like this? No, I'm going to do what? I'm going to hyperextend my back or have an increased lordosis. Where are the two places this may make me hurt? And I'll tell you, it's not the hip.
Lower back.
Low back or?
Say right here.
Huh? Femurs don't hurt much. They don't have innervations.
Your hip.
Huh? The knee, why?
Making the angle, your center of gravity is not pushing straight down like it's supposed to.
And what's having to work a lot?
That would be like your meniscus, is what is causing too much.
Menisci don't work.
Your IT band?
My IT band doesn't work. Okay, folks, stand up.
Would be
Flex your hips. No, flex your. In standing, flex your. Flex. Flex. Now, come upright. So what has to happen at your knees? What are you rubbing?
Quads.
The quads. So somebody's right, you may get abnormal weight bearing in the knee and damage the knee, or your quads may start hurting. Okay, sit down. I'm a dirty old man. I'm 68, a male. I got this cute young thing who's got back pain. And prior to stretching, I want to ultrasound the iliopsoas. Am I going to have to do a heck of a lot of explaining here? Am I going to have to justify what I'm doing? Explain why I want to... She doesn't hurt there, and I want to treat her there. Okay? I'm not trying to be Larry Mead here. I told you about him yesterday. What I'm saying